Welcome to the magazine segment. Now, every year, Kenya loses approximately 30,000 children to diarrhea and respiratory infections. This translates to an average of 100 children per day. That is a perfect public school class. Now, however, this disease can often be prevented by the simple habit of washing hands with soap, a habit that has been proven to reduce the incidence of diarrhea disease by over 40%. Now, hand washing has been a key issue for Unilever, and indeed the government through the Ministries of Education and Public Health and Sanitation. Now, as they seek to achieve MDG Agenda 4, that is reduce child mortality, that is by two-thirds through active promotion of course, hand washing with soap, Myriam brings a variety of skills and experiences to the public health world. Since 1999, she has worked with NGOs, UN organizations, academic institutions, and private sector on hygiene promotion programs. So Dr. Myriam Sidibe, we joined with Dr. Myriam Sidibe, that is a Unilever Global Social Mission Director. Welcome, Myriam.
Thank you very much.
Okay. Now, Myriam, we'll begin by this. You've done this thing for a very long time, and your accolades are very, very high. Yes. So what have you found throughout the world as you help use hand washing in combating this very, this disease you're taking over our children?
So what we've learned throughout the years is threefold. I would say one, from an evidence perspective, we've realized that hand washing with soap indeed can save lives. So we know that if you could get people to wash their hands at the right time and at the right occasions, you can reduce diarrhea rates by over 50%. So on average 47% is the exact number. We also know that people are not washing their hands. So that's my second point. I think that today what we know is that it's not a matter necessarily of Africa, of Asia or Europe. That the rates today, 1 in 4 mothers doesn't wash her hands after she changes her nappies around the world. And Kenya is no exception in that respect. We realize that the norms of hand washing with soap is just not there. And thirdly, that we need a motivation that's beyond health. That if you want people to wash their hands, then you need to make them believe that everyone else is doing it, and that the need for social norms is very important. So those are a few things that we've learned so far. Happy to share them.
Okay. Now, you are the forefront on spreading the messages of hygiene, and of course throughout the world, in making sure that everyone understands, the need to be clean, the need to have a, hygiene-free, hygienic environment. So what does the World Health Day mean to you?
The World Health Day is an excellent opportunity for us to put at the forefront key messages, key prevention messages such as hand washing with soap and hygiene. This year, World Health Day 2012 is about, basically living longer by adopting good hygiene, health habits in general. And for us, this is something that Lifebuoy and Unilever has been doing for decades. This is part of our DNA because, we believe that if you can get people to do the right habits at the right time, and that you can embed it in their way of life, that then obviously they will grow to be consumers that feel good, look good, and get more out of life. And that is essential to health. Health starts by these daily routine habits.
Okay. Now, as a hand washing crusader, you just mentioned, what the World Health Day will mean this year, of course. So what's your key role in this year's World Health Day?
So we're trying to get moms around the world to share their tips on hand washing with soap and how they get their kids to practice it, because I think what we've learned most importantly is that the answers lies within us, within us mothers. Myself as a mom with an 8-year-old, that's my biggest crusade, is to try to see how my daughter and obviously her friends and her peer groups actually practice the habits. So we're running a Facebook competition, for example, where we're getting moms across the world to share their tips on hand washing with soap with their kids. We will make sure that we continue spreading our message on health and hygiene across the world as well on this particular World Health Day.
Now, you've mentioned you're a mother, and sometimes getting children to constantly wash their hands and telling them, you need to do this, can be a bit taskful, especially when they become playful or they want to pretend they've washed their hands well because you've told them to, and they want to make sure that you see it. So how do you make sure you instill into a child the basic needs and necessities on why they should wash their hands to avoid this disease which you just mentioned earlier?
I think most importantly, children need to be. I mean, one of the things that I've learned is that you need to make them ambassadors of their own destiny. I think once they become ambassadors and they feel that they're carrying a message that they feel important about, it becomes much easier for them to feel without shame that they can remind their peer group around that. So I think that's a very important message. I think second of all, just ensuring that soap and water is available in the homes, because you can talk about the message, but if in reality the practice is hindered because actually the water and the soap is not available in the homes, it makes it difficult. And thirdly, obviously the parents need to be role models.
Of course.
Because I think ultimately the child always will model. So if you talk about hand washing before food, but you tend to forget it before you start eating, then the child will say, well, this is something that we say, but this is not something that we do in my house.
Okay. Now, you've been posted to Kenya as a global mission director of this particular cause. So what are you doing to make sure that you leave a mark in Kenya when it comes to hand washing and hygiene?
So it's a pleasure to be posted in Kenya. I'm very excited to have an opportunity to be able to impact the landscape and the environment in terms of health and hygiene. We have many things that we have planned on our communities, on Unilever in general. So our objective is to change the behavior of 1 billion people across the world. The contribution of Kenya is about 8 million. So the way in which we plan to reach this 8 million is, one, obviously set up schools program. So we are working with PSI, we're working with WUSUP, so the Water Supply for the Urban Poor and Population Services International, and the Ministry of Public Health and Sanitation, to ensure that we get hand washing in schools for about 500,000 people.
500,000 people.
500,000 students this year. So this is only for this year, but then it needs to accumulate to about 8 million by the time we get to the MDG 4, so 2015. So that's obviously that. The second thing that is very important is obviously our programs to moms, because as I said, moms are very important reinforcers of the behavior, and we need to make sure that we target the moms, especially the new moms, for the moment that they've just had a new child. They're much more amenable to changing their behavior, and that's something that we need to keep in mind as well.
Okay. Now, we have 94% of students who don't really practice hygiene, they don't wash their hands, and 37% actually do. So why the case? What happened?
Well, if they are evolving in an environment where it's not made normal to wash your hands, then you don't. I think
normal. I like
normal,
that.
and I think because I think ultimately the most important word to keep here is norms. If you live in a society where hand washing with soap is not regarded as a way in which you are seen as a good citizen, or if you're seen as a good pupil, then you will not practice. So I think the reversal that needs to happen is, how do we create schools that consider hand washing, the use of their toilets, as the norm? That it is just not okay to have a school that doesn't have a toilet, or it's just not okay to have a school that doesn't practice hand washing with soap. I think that will help a lot. So I think it is very important that we work not in silo, but in partnership with the government, with the NGOs, with the parents, to make sure that we get these habits into the schools.
Okay, when it comes to campaign to make sure that people get this message, especially whether it's adults or young people, what's your most passionate campaign that you've done so far that you feel, yes, it had an impact till now? Of course you've done many, I'm sure, but the one that you felt had the greatest change.
I think that in terms of advocacy and profiling hand washing with soap, I would say Global Hand Washing Day is, and it's coming again on October 15th. It's the 5th year we are celebrating it. It's one of the global campaigns that we developed with our competitions, but we worked very hard to make sure that it becomes a forefront of profiling hand washing with soap. It's about celebrating hand washing in one day, and it allows us to be able to at least put it on the agenda and trigger the change that we need.
Now, diarrhea is one of those diseases, like I mentioned earlier, when we began this interview, that is sticking on your children, respiratory infections. So is there any other disease that has been highlighted and pointed out that is also gotten by the lack of hygiene and, like you said, washing hands?
So I think there's obviously all the skin infections that one can transmit. There's everything around eye infection, which is very tangible, because if you're a pupil and you're going to school and then you get eye infection and trachoma, that that becomes a big issue. So I would say, I mean, it's not only that we need to deal with mortality. I think morbidity is very important for school-age child.
And speaking of that, just to interrupt you there a bit, are you rather conducting any awarenesses in schools to make sure that even teachers, are able to, put it somewhere in their subject, even if it's for like 5 minutes, in making sure that these children understand the need to do so and how these diseases can become fatal in future?
So I have to say that a lot of governments over the years have actually integrated hand washing in the curriculum, and they need to be applauded on that. So there is a lot of hand washing integrated in curriculum. But teaching is not equal practice. Just because you teach doesn't mean necessarily you practice. And I think that is one of the key takeouts from the curriculum versus changing behavior. And that is very clear in terms of what exactly we need to think about. This is where we see our role as a brand. This is where we see our role as a corporate company, as a reinforcer of this behavior. And that's something that we need to keep in mind.
Okay. So what will it take for Kenya to make sure that, as a country, we achieve MDG 4 by 2015?
So, I mean, I don't think we could take here I can talk about the bold ambition of achieving all of the MDG4, but I can at least talk about the contribution that we can make in terms of hand washing with soap, and then obviously the potential reduction in terms of diarrheal disease and respiratory infection. I think it will take a couple of things. One, it will take significant resources from brands like Lifebuoy and Unilever to make sure that we land these programs at scale. It will take partnerships with government, partnerships with NGOs, so that make sure that we leverage the right network so that we can scale up. And then finally, it will also take a partnership with the parents, so that we create a norm in Kenya which is actually set around better hygiene and health, so that it is embedded in almost every household as something that we just need to do.
Which is normal, like you mentioned earlier, of course.
Absolutely.
So what is the key challenge to maintaining proper hygiene with soap? People take it as something very simple, but I'm sure adults, even them, it's just a point where we also, like, okay, fine, I'm supposed to wash my hands. That's supposed to be normal, right?
Yeah.
That kind of a attitude. So what is the proper challenge when it comes to, key hand washing with soap?
I think the biggest challenge is I would say one, facility is always an issue. So what we've found out is that if you put the soap and the water in one place, then people tend to remind. Because the biggest issue is not actually creating a conscious behavior, but creating an unconscious behavior. Because what happens with hand washing with soap is it has to be something that you do almost naturally. It cannot, because it's something that normally you should have embedded in your childhood growing up, that when you pass the sink after you come out of the toilet, you automatically use it and wash your hands with soap. But if you have grown up in an environment where that setting was not necessarily clear for you, or the routine was not actually set up for you, then this is what we need to embed with our program. So make sure that people practice it enough so that it starts becoming a habit. I think that is one of the biggest issues, obviously, that we're facing. And then I keep coming back to norms because it is my favorite word. But it's about creating these new norms where we have new communities, new families that say, well, I'm a hand washing family for sure.
Of course.
And it's not something to be ashamed. If someone come into my household, before they touch my baby, I ask them to wash their hands.
That is also key important. I know. I have a son, and whenever that happens, I'm like, okay, fine.
Before you touch my baby, please wash your hands.
Make sure you do so. Now, when it comes to rural areas, like you said, there are many places with no facilities to make sure that this is happening. Are you also making sure that you have campaigns out there in rural areas of Kenya to make sure that these children are aware? Because they don't know. You'll find them running on the streets.
Absolutely.
They've played with dirt. They'll go to class and they'll touch books and stuff, and they'll go back and still eat with the same.
Absolutely. And I think the rural community is a very important target for us. We've got rural programs all across the world. We've run one of the largest rural outreach program ever done in the world, with touching over 130 million people in India. We are setting out what exactly how we'll be entering the rural in Africa, because ultimately the health and hygiene needs to go to the people that need it the most, and ultimately our products are not supposed to be necessity. They're supposed to be they're supposed to be for everyone. They're not luxury, I meant to say. And then soap is basic. So even when you go into a rural household, whether it's a laundry bar, whether it's a multi-purpose bar, or whether it is a Lifebuoy, the reality is 97% of households have access to some sort of soap. So it is the regular usage and the general awareness of the right occasion that's lacking at this point. So yeah, it's a very important target. At this stage for 2012 we're thinking of schools, but we will be targeting rural areas starting in somewhere around Kisumu.
Okay, that is now in making sure that you try and get them facilities, and if I may also ask, sensitizing them also?
Absolutely, absolutely. Sensitizing them, mobilizing communities and village elders so that, they can, welcome this sort of initiatives.
Okay.
And that, people are not offended because we talk about hygiene, but rather we can make a joke out of it, but then raise it up the agenda as well, because it is actually not a joke.
Exactly, because you just said that. I mean, people may wonder what's the big deal about talking about hygiene, but at the same time when you look at the rates and the scorecards and you see how many mortality rates of children who have died because of diarrhea and respiratory infections actually becomes something key and disturbing. On my next question, anything you'd want to add, on hygiene that you feel is important and the public needs to know and understand that despite it may look at it like a joke, this is something important and key in making sure our children, live a hygienic life?
I think in general, like I said, for me it all starts at home. So home is the most important unit where behaviors are picked up, and then the best thing that you can do is obviously partners with home, because if you partner with homes, then you partners with moms, then the behaviors will happen, because this is not a behavior that's costing a lot of money. It is not necessarily a behavior that's going to change your household income so much, but it is going to change the way your child brings or not a flu in your household.
Of course.
And that
all of you will get the flu.
All of you will get the flu. And then the cost that this has into, in terms of the poor income that people get and having to spend it on medicine rather than, and having to keep your child from school, and then later on he then misses out on the exams because he has missed so many days in school. I think those are things that one doesn't account from the starting point, but it only takes really getting a simple habit into the household for you to get to a point where, it starts making an impact for your family, but also for the environment, because I think everyone can be a role model. And you don't know if you can change everyone, but you can start by changing yourself.
Of course, of course. Well, Myriam, thank you very much for coming in today. Thank you for your time and sharing with us this topic that some people may see as simple, but it's very, very, very important. As like I mentioned, you need to look at the scorecards and the rates, and you see how important this issue is. So thank you so much for coming in today.
Thank you for inviting me.
You're welcome, and all the best with your endeavors.
Thank you very much.
You're welcome. Now, that has been Dr. Myriam Sidibe, the Unilever Global Social Mission Director. Just told us exactly how hygiene is important and making sure our children wash their hands, with soap after everything they do. It doesn't matter if they're from playing, if they're from, the toilet, whatever it is, they have to make sure that they are clean. And as parents, and of course anyone with the responsibility over children, make sure that these children are, that they adhere to rules, and you need to make sure that they actually clean and wash their hands. Well, coming up shortly is the lead segment, and we'll be having our political reporter Michael Mayaka telling us about the story he did yesterday about Minister Eugene Wamalwa. So keep it here.